is John Poole. I'm doing my interview. My client is named Sigmund. He's already been through intake. He is a 19-year-old male. He has had a few violent episodes in his life. The last time he was in jail was for threatening to kill his girlfriend after he had a restraining order put on her. He does have a history of suicides, and this last attempt was in the county jail, and he attempted that by hanging. He's met the criteria for borderline personality disorder, and that was figured out by a diagnostic interview. He also has depression, and he is on the threshold of drug abuse, which he says he hasn't used, but I'd like to verify that with a drug screening. And he also has a problem with self-mutilating. The scene is we've already met, and we are getting ready to sit down in the office and get ready for the session. The actor in my session is a neighbor, and he will be portraying Sigmund. Hello, Sigmund. I'm really glad you made it today. I know that in the past you were having a little anxiety about coming in today, and I'd like to thank you for making it in. You've seen Laura, right?
Yes.
Okay. Laura presented some information about you at the team meeting today, so I know that you are meeting the criteria for borderline personality disorder and the program dialectical behavioral therapy. What I would like to know from you is like what your problems are and what you wanted to come out. What do you want to come from you coming to these meetings? And I'd also like to know how you learned about our program.
Do you know Dr. Jones? He's my community corrections psychiatrist. I started with him for help with my depression, and he said he thinks I have borderline personality disorder, and I should start a program like this.
Okay, so you were referred by Dr. Jones. Let me ask you this, do you mind if I take some notes? Because I'm having a hard time remembering this. It'd be easier if I could take some notes.
That's fine.
Okay, I appreciate that. Do you know what his first name was?
I don't know.
Okay. So he referred you, and then you met with Laura. So let me get this straight. Does that mean you saw him as a psychiatrist for depression? And also, is it correct you also had a psychotherapist at the time?
Yes.
Okay. Do you still have the psychotherapist?
No.
Okay. You don't have that therapist anymore? Okay. Who was that therapist? Do you remember his name?
I think his name was Jim.
Jim. Okay. And you're not still seeing him?
No, he got a restraining order on me.
You did. Okay. When did that happen?
About 3 weeks ago.
So 3 weeks ago, you were seeing him, and then he got a restraining order on you?
Well, I don't know if he got a restraining order. That's what he threatened me with.
Okay. So does that mean you terminated the therapy, or did you both decide to terminate therapy?
Well, I think we both terminated it.
Yeah, I can understand that. I would like to start with is what you'd like to get out of therapy. And I'd like to get to know you a little bit, and I'd like for you to get to know me. And then at the end, we can decide, like first I'll be able to decide if I'll be able to help you, and then you'll be able to decide what I'd like you to be able to decide, so you think I'm the person who'll be able to help you if I can make an impact in your life.
help, so psychologist